Topic is suicide among African Americans, and we're talking to Dr. CPoe. And of course, Dr. Poe, before we had our first commercial break, we were talking about the psychological feeling of despair. Let's move that a little beyond that and to talk about people who exhibit behaviors of despair, the relationship between people who are in a state of despair and their behavior, either before or after despair. Let's talk about it from that perspective.
All right. If I'm in a condition of despair, generally my behavior has been self-destructive on the front end. That is, my behavior has been self-centered. Self-centered behavior on the part of an affected person is the most common cause of despair. And we can be more specific about that. And that is greed, for example, for money, for power, greed for a sense of superiority over the people is, I believe, the #1 risk factor, the #1 contributing factor to that leads to a condition of despair. Now, once a person is in that condition, then we can expect that person's behavior to be even more self-destructive. It's like self-centered behavior causes despair, and despair intensifies self-destructive behavior or self-centered behavior. Okay? And so people in a condition of despair, they're more likely to abuse alcohol, they're more likely to abuse drugs, they're more likely to be sexually promiscuous, they're more likely to get into fights inappropriately, they're more likely to be mentally abusive of the spouse and physically abusive of the spouse and the children, they're more likely to be sexually abusive, okay? They're more likely to commit adultery, they're more likely to get involved in fast money-making schemes, illegal money-making schemes, all right? So that's what we see in self-destructive, in despair, is self-destructive behavior.
And of course, individuals who become involved in all of this negative behavior are more than any other individuals more prone toward a suicidal as well as a homicidal reaction and activity. Is that what we're saying?
Yes, because a condition of despair involves a certain amount of spiritual isolation. If I'm in a condition of despair as a result of being self-centered, as a result of doing my own thing, as a result of rejecting the authority of God, then that means I don't have the right relationship with God. And that means that I'm spiritually isolated. And spiritual isolation contributes to social isolation. Okay, so imagine then, I'm in a condition of despair because of persistent selfishness. And so that isolates me, even from family members. I don't feel close to them. I'm there, but I don't feel close. I don't feel close to anybody, all right? And so that increases my sense of alienation. It increases mental, emotional, and spiritual pain. And so I'm likely then to do something to get rid of the pain. And sometimes that's a suicide attempt or a completed suicide.
And so, Dr. Poe, when we see all of these conditions developing, when we talk about spousal abuse, when you talk about promiscuity, sexual abuse, and et cetera, these are some of the indicators, you're saying, of an individual who is leading toward destruction of self. And if an individual will destroy self, he will certainly destroy other individuals as well. And so that's the making of a suicide. Is that what we're saying?
Yes. Persons who are destructive towards others, who abuse others mentally, physically, financially, politically, all right? If I mistreat others, what that usually means that I'm in a condition which is a consequence of rejecting the authority of God. That means that I have a pattern of self-centered behavior, all right? It's caused me to be in a condition of despair, and that condition of despair has intensified my self-centered behavior or my destructive behavior, okay? So we see then that people who are self-centered, they're more prone to despair, and people who are self-centered and in a condition of despair are much more likely to be even more destructive of others as well as themselves. And that increases the risk then that they may commit suicide. Now what that means is that people who are very self-centered, who are very selfish, who are very prideful, all right, who mistreat and abuse other people are more prone to suicide. We see it in this culture. Persons, we know that Caucasian Americans have a much higher suicide rate than Afro-Americans. Well, if you look at the history between the two peoples, more Caucasians have been abusive of Afro-Americans than the other way around. And so the result is Caucasians have a much higher suicide rate. Okay, we have a much lower suicide rate. Okay, but if you look at the male-female situation, males are more abusive of females than females are of males. Males have a much higher suicide rate. Okay, if you look at a relationship, the husband or whoever is more abusive will be more prone to suicide.
And not only will that person be prone to suicide, he'll also be prone to homicide as well.
Be prone to homicide as well. But I think, though, that oppressed people have a tendency to turn on each other. They have a tendency to have a little bit higher homicide rate overtly. Okay?
Explain that, Dr. Poe.
Well, for instance, Afro-Americans nationwide, we have a little higher homicide rate than Caucasian Americans. All right? But Caucasian Americans have a much higher suicide rate. But we need to examine that further because, you see, there is mental homicide as well as physical homicide. And so you might say that whites are more mentally homicidal in relationship to blacks and in relationship to each other. We are more physically homicidal in relationship to each other, but not so much in relationship to whites. Okay? So I would say that who has the higher suicide rate is probably the more self-centered. It's probably the more abusive of other people in general.
Well, Dr. Poe, let's look at some of the warning signs. We know that all of the negatives that you mentioned in terms of despair could certainly be warning signs, but what are some of the things that you would identify that would be common to all suicides that would be a part of that sort of warning signs?
Well, some of the warning signs are persons who manifest a change in personality. They used to be very outgoing and now they're very withdrawn. Persons who are overtly hostile towards other people are more prone to suicide. Persons who are persistently having problems sleeping or they persistently oversleep. Persons who begin to manifest persistent crying. Persons who's preoccupied with death and dying or the past death of a loved one or some anticipated loss. Persons who are determined to have their own way. Determined to have their own way. Persons who are arrogant in their attitude.
Very good. And of course, Dr. Poe, let me interrupt here for this final commercial break, after which we'll come back for this final segment. We'll be back with you following this short commercial break. The topic is suicide among our